Hello, dear friends. Today's conversation is about insomnia and the associated state of daytime sleepiness. We will understand why sleeping disorders occur and what to do to overcome them. Insomnia is difficulty initiating sleep, maintaining it, waking up early, or suffering when sleep is not restorative. Since sleep needs vary among people and range from 6 to 10 hours per night, sleep duration is not as critical as subjective feelings. Insomnia causes impairment of emotional status, memory, and mental and physical abilities, contributes to the development of cardiovascular diseases, affects life expectancy, and increases the risk of road accidents. Insomnia comes in primary and secondary forms. Primary insomnia is an independent disease with no apparent cause. Secondary insomnia is a symptom of a medical condition. Sleep and wake cycles are regulated by the biological clock, which is located in the hypothalamus. The biological clock is a complex set of chemical interactions that affect the release of melatonin in a 25-hour cycle. Melatonin is produced in the epiphysis, the pineal gland. The epiphysis is located in the brain. Its activity, among other factors, is also affected by light. In bright light, melatonin is released less, so we do not sleep during the day. Disturbances in the biological clock affect the sleep phases and lead to insomnia. The chemicals involved are dopamine, serotonin, norepinephrine, and acetylcholine. Dopamine stimulates the waking state, while serotonin, acetylcholine, and norepinephrine promote the sleeping state. An imbalance of these substances leads to sleep disorders. The causes of insomnia can be categorized into three groups. The first group is conditions associated with somatic diseases, such as sleep apnea and obstructive sleep apnea, which occurs mainly in obese people, and pulmonary diseases and cardiovascular system, such as arrhythmia, senile dementia, Parkinson's disease, etc. Sometimes the reason for disturbed sleep can be prostate adenoma in men. In this case, frequent night trips to the toilet do not give a proper night's sleep. Disorder of the endocrine system, for example, hyperfunction of the thyroid gland, also causes insomnia. The second group of causes is a mental disorder. For example, about 40% of people with depression experience sleep disturbance. The same happens with people with anxiety disorders. The third group is environmental sleep disorders. These are uncomfortable sleeping conditions, too hot or cold, noise, light, working different shifts, and the like. Determining the cause of insomnia requires distinguishing when the problems occur. If difficulty with sleep onset is prevalent, the problem is most often an anxiety disorder. If sleep onset is regular but problems occur when a person wakes up in the middle of the night and cannot fall asleep, this could be a symptom of depression, a physical health disorder, or a manifestation of a pain syndrome. If a person wakes up earlier than necessary and cannot fall asleep, such a condition is most often characteristic of the symptoms of major depression. Accordingly, sleepiness during the day is a symptom of a lack of sleep at night. In addition to establishing the nature of insomnia, some medical tests are performed for diagnosis. They are most effective in detecting obstructive apnea when the airways are blocked during sleep. It is typical in obese people and those with upper respiratory problems. Here, information from family members who can see how a person sleeps, whether they snore or choke, can be helpful. Thyroid and adrenal gland function can also be examined. Sometimes electroencephalography and polysomnography are performed. It is a study where many parameters are recorded, including the oxygen content in the blood during sleep. An electrocardiogram is performed and even filmed on a video camera as the person sleeps. With such tests, problems such as heart failure or prostate adenoma become obvious. It is also essential to understand whether there is abuse of alcohol, coffee, or psychoactive medications. If physical and pharmacological causes of insomnia are not found, information about sleeping and working conditions, such as shift work, is considered. Having ruled out all causes, one stops to look for psychiatric reasons. It is the most complicated situation, as insomnia can be primary, occurring for no apparent reason, and secondary, and a consequence of an anxiety disorder or depression. The problem is that insomnia can cause anxiety and depression. Conversely, depression and anxiety lead to insomnia. Treatment for insomnia must address the cause. If we are dealing with a medical somatic condition, then it is simple. Eliminate or compensate for the cause and get better sleep. A simple example: eliminating thyroid dysfunction eliminates the sleep problem. Problems with external conditions are also easily solved. It is necessary to create a comfortable environment, and sleep will normalize. If a person has signs of an anxiety disorder or depression, antidepressants and psychotherapy are prescribed. The most difficult is the treatment of primary insomnia, which has no apparent cause. Often, at the same time, sleeping pills are prescribed that will help normalize sleep, but their use for longer than 2 weeks is not welcome. Treatment of insomnia with drugs is not the topic of our conversation. Let's focus on simple and effective measures that help normalize sleep. First, it is a regular regimen. Go to bed and, most importantly, get up in the morning at the same time, even on weekends. Use your bed for its intended purpose. If you cannot fall asleep within 20 minutes, leave the bed and come back when you feel sleepy. Avoid lying on the bed unnecessarily, watching TV on the bed, reading, or eating in bed. Don't sleep during the day. This increases insomnia. The exception is people who work in shifts. Establish mandatory rituals before bedtime: brushing your teeth, washing your face, setting your alarm clock, etc. By doing so, you create a reflex for falling asleep. The bedroom environment is essential. It should be dark and cool enough. Use comfortable pillows. Even pillows under the lumbar region and between the legs can be helpful for some people. Exercise regularly. Just remember that intense exercise before bedtime can disrupt it. Use relaxation techniques, warm baths, breathing exercises, and other muscle relaxation techniques can help you relax. Pay attention to nutrition. In the afternoon, avoid chocolate and drinks containing caffeine. Do not take diuretics, do not drink too much, and do not overeat before bedtime. Avoid exposure to bright light just before bedtime. Let's summarize. If insomnia occurs, somatic diseases, anxiety disorders, depression, and external factors must be identified or ruled out. If the cause of insomnia is identified, you need to work on it. In any case, whether the cause is found or not, you need to follow these 10 rules for a good night's sleep that I described. Thank you so much for listening to the end. Good health and quality sleep, everyone. Always for you, Dr. PopMed.